My name is Voirrey Walsh and I'm the Programme Lead for Step Into Health. I served for 16 years with the Royal Engineers, and on retirement from regular service in 2017, I transferred into the Army Reserve as a medical support officer. I also retrained as a midwife and qualified in 2020. And until February this year, I worked in a frontline NHS role before taking up post as Programme Lead. So Step Into Health, it's a government funded programme and it's led by NHS employers, supported by our key partners who are NHS England and NHS Improvement, Walking with the Wounded and the Royal Foundation. Step Into Health is a programme that supports members of the UK Armed Forces, the Armed Forces community, into employment roles within the NHS. It also supports pledged NHS organisations across England and Wales to recruit members of the UK Armed Forces community into their workforce. So Step Into Health was created because the charity Walking with the Wounded, in partnership with the Royal Foundation, recognised that members of the UK Armed Forces community had loads to offer when their service ended. So with support from the NHS and Higher Education England, they piloted a scheme across 5 sites, and that was to introduce members of the Armed Forces, UK Armed Forces community to the NHS and the NHS to the UK Armed Forces community. It showcased the roles, opportunities and benefits of working in and for the NHS, and vice versa, the benefits and capabilities of the Armed Forces community as members of the NHS workforce. The pilot programme was a huge success, and from 5 sites, it's now blossomed to 117 with more to come. And Northumbria Healthcare NHS Foundation Trust, obviously one of these sites. And there's ongoing recognition of the transferable skills, excellent cultural fit and positive mindset of the UK Armed Forces community as members of the NHS workforce. And the Armed Forces community remains a heavily sought after pool of talent to recruit from. There are obviously clinical and non-clinical roles available in the NHS, and much like the Armed Forces, there's a huge range. I think it's 350 at this point in time. But Step Into Health supports the UK Armed Forces community into both clinical and non-clinical roles. And the non-clinical roles, for example, include HR, admin, estates, logistics and project management. There's something for everyone out there. So if you're a member of the Armed Forces community and you are interested in working for the NHS and in particular the Northumbria Healthcare NHS Foundation Trust, please visit the Step Into Health website and also the Northumbria Trust website. With the Step Into Health website, you can create a profile on our candidate system. Make sure that you select Northumbria as an organisation that you'd like to work for. Once your profile is live, the team from Northumbria can get in touch with you directly through the messaging system to find out a bit more about you and your skills, so they can link you with suitable roles and the vacancies that they have at that point in time. If you're interested in something completely new, then let them know. When you apply for a role, please consider responding to the Armed Forces Indicator question. This helps them identify you as an Armed Forces candidate and can open up support for your application. If you receive a successful job offer, please continue to identify your Armed Forces status to the HR team during the onboarding process and link in with the available forces networks who can support your transition into your new role. And if you're unsuccessful this time for whatever reason, Northumbria can provide you with feedback for your next application. But Alex will be able to explain further how the Northumbria team can support you as a member of the UK Armed Forces community through their application process.